Is hypoxia related to external cervical resorption? A case report by Mavridou et al. In 2019. The aim of this work was to investigate the existence of hypoxia in external cervical resorption. A case study of vital tooth number 8 having external cervical resorption of a 27-year-old male. The patient mentioned that he had history of trauma at his front teeth at age of 14. He also mentioned that he has parafunctional habits and bruxism. Clinical examination of tooth number 8 revealed a pink spot at the buccal surface of the tooth. Portal of entry of the resorption cavity was identified. Periodontal examination revealed gingival inflammation. Combine computed tomographic analysis was performed in order to visualize the three-dimensional extent of the resorption, the relation of resorption with the pulp, and the extent of repair by bone-like tissue. Based on clinical finding and CBCT, treatment of the resorption was not possible and tooth was for extraction. Nano-CT and immunohistological analysis was done in order to visualize the 3D extent and morphological characteristic of the resorption area and the pulp. The resorption area was observed in 3D imaging by coloring the different regions of the tooth. Repair by pericanal resorption resistance sheet was observed. This sheet plays a vital role in protecting the pulp. It consists of predentin, dentin, and bone-like tissue in growth. The bone-like tissue in growth was observed in the resorption cavity, and it was believed that hypoxia can regulate osteoblast formation. Based on the 3D nano-CT analysis of the tooth structure, 3 regions of interest in the resorption area and the pulp tissue was selected: apical, middle, and coronal. In this way, the 3D images can be linked to the histological analysis. This is a sagittal view of nano-CT image analysis of pulp showed the formation of pulp stone. For the histological analysis, gram staining revealed no bacteria at the resorption front. This absence of bacteria may indicate that in this particular clinical case, bacteria were not primarily responsible for the propagation of the resorption. However, this does not exclude the fact that bacteria could play a role in the initiation of external cervical resorption. Nevertheless, bacteria were found at the margins of the resorption. This shows that poor oral health could be responsible for a secondary invasion of the resorption cavity. Hypoxia-inducible factor was used to indicate the existence of hypoxic environment. Cells were found within the resorption area, especially fibroblast and smooth muscle cells surrounding blood vessels showed hypoxia. In addition, hypoxic cells were also in the pulp and at close proximity to the pulp stone. In this image, we can see odontoblast, nerve fibers, fibroblasts, and cells surrounding blood vessels showed hypoxia. Also, clastic cells were observed mainly at the apical area of the resorption, were found to be positive to hypoxia-inducible factor marker. In conclusion, hypoxia has been recently linked to external cervical resorption because it can regulate clastic cell formation and activation. However, hypoxia alone cannot cause external cervical resorption, but a mechanical or chemical factor is needed.